So, Dr. Barrett, you have a background in internal medicine and you transitioned over to aesthetics. What inspired you to make that transition?
I think it was many things. First of all, I didn't like the direction internal medicine was going. It was definitely changing. I started practicing when I spent a lot of time with my patients and meticulously took care of them, and I was unable to do that anymore. I had also started doing aesthetics in my practice, a little Botox, a little skincare. That's all we had back then. So that was actually really fun and really exciting for me. And I could see these differences and how happy it made people feel. So I knew I wanted to continue and do that. So, and then my children were little and they needed to have a mommy more with them. So at the time, I was able to do that and focus on just aesthetic medicine. But the kind of really cool thing about it is medicine. So it's aesthetics, but it's medical, and it's super important to have a good background. So my internal medicine background, I think you guys see it in the office a lot.
Absolutely.
Yeah, really helps me understand these patients, what's safe, what's not safe, and we help them out with so many other things too. So.
Absolutely. So aesthetics is ever changing. Are there any particular treatments or products that you're excited about right now?
Right now, I would say the top of my tongue is exosomes. It's kind of a new thing that's happening. We've all heard of stem cells, and I think everybody's heard of PRP. It's in that same genre. So again, a nice medical treatment. It actually is a very concentrated young source of not stem cells, but more growth factors and cytokines, and they mix in some hyaluronic acid and some peptides. So all those great things that are actually healing and anti-inflammatory. So it actually helps with better results. We're using it for hair growth. We're using it for lasers to get better results and better healing. It's actually a very exciting field right now.
Very exciting. Over the years since you've worked in aesthetics, is there one treatment that has been your go-to? Personally, do you have a favorite?
I think you probably know what that is, and most of my patients know what it is, but it is radius for sure. So right now, I would say for the past 17 years, I think that's how long radius has been around. That is my go-to for lifting, and it made such a big difference in my practice because we went from treating lines and wrinkles to actually treating the cause by lifting with radius. Right now it's radius. If something better than radius comes along, it's going to be that. But I love showing patients how when we lift their face, which they do in the mirror all the time at home, I know.
Absolutely.
Yeah, when we lift it, these disappear, and it's so much better of a treatment than treating their nasolabial fold or their marionette. So
one of the things that differentiates radius as a filler is that it prompts the body to produce collagen. Are there other treatments within our practice that are your go-tos for induction of collagen for patients? Any favorites?
Yeah, of course, Sculptra. So Sculptra it's an injectable as well, and it's going to stimulate your collagen. It's like ground up suture material, and what it does is it stimulates collagen growth in your face, so it gives back volume. As we age, we lose volume in our face. We lose bone, we lose muscle, we lose fat. So we can help grow more tissue, and that's going to give you a nice lift when it's placed correctly. And it's all about your body building its own collagen. So that's nice. It's wonderful, and it's long lasting too. It lasts 2 to 3 years.
Let's see.
You need a job in what doing interviews.
I ran out of questions.
You need to go on TV and be a news anchor.
That's what I studied in school, and then I found out, news anchors, it's tough. And I was talking to Jim Irwin, the news reporter, and he said it's not a good field for them. You made the right choice.
It's a tough life.
Yeah, everything's on your phone now and online.
Yeah.
oftentimes I speak with patients, and when they think of neuromodulators, the first product that comes to their mind is Botox, which we do offer to our patients. Can you share a little bit with us in regard to what neuromodulators are and the neuromodulators that we offer?
Sure. So neuromodulators are actually a toxin. We don't like to say that, but it is a medication, and it actually blocks your muscle contraction. And so when people come in and they think I'm going to put the Botox in their lines, I'm actually going to treat the muscles that are causing those lines. And it's that repetitive motion of, frowning, smiling, raising your eyebrows, that repetitive motion even of puckering when you speak.
Yeah.
These motions will end up giving you deep lines and wrinkles.
Mm-hmm.
So we've got Botox, we have Dysport, we have Xeomin. There's one, Jeuveau, I do not use it, but all these are the same drug, just little differences in their formulations, and they have little differences in how they work. So Botox is, of course, it's what everybody knows, like Kleenex, but there's all different brands, and they all work the same way. I usually encourage my patients to try all three, so then they can figure out which one is the best for them. But I usually say 75% of my patients really won't notice a big difference between any of them.
Okay.
And then I say, well, then it's just a price difference, because Dysport and Xeomin are a little cheaper. They're not a cheaper product, but they're less expensive, I should say.
And what are some common areas of the face that you treat? Oftentimes when you see advertisements for neuromodulators, the most popular area is the forehead and the 11 lines. Are there any other areas of the face that you treat?
Yes. So I'm known for my, we should probably call it the Barrett brow lift.
Oh, yes.
Every patient that comes in, they're saying, don't forget my brow lift. Did you do my brow lift? And it's always the first thing that wears off, but I do a little injection here, and actually relaxes the muscles that pull down the brow, so the brow kind of floats back up. So
And we could all use a little lift. I think we could all use a little lift.
everybody can, and it's really miraculous. It's a tiny amount. Of course, the crow's feet. Crow's feet, you have to be careful, because sometimes it's really just the cheek pushing up, and it's not the muscles. I always tell people when they get injected to make sure that whoever's injecting them is actually testing their muscles, looking at their muscles to treat, because everybody's muscles work differently. They're in different areas. And then, of course, one of my favorite areas, everybody knows me for, the chin.
Oh, yes.
So chin and the muscles that pull down the corners of the mouth, and then the muscles that purse your lips.
Yes.
So if we get those in time, we can prevent a lot of things. We can prevent those lip lines that everybody tells me, I never smoked, I don't know
Such
why
a
I have these."
misconception.
It is. I would say 99.99% of our patients have never smoked a day in their life, and they still get these.
The pesky little lines.
So don't purse when you talk. But a lot of people can help that.
Yes.
So that's one of my favorite areas.
I also see a lot of patients who come in for neuromod treatments, and they're surprised to find out that this pesky little line that runs underneath their lip is caused by the way that they speak, as well as what we refer to as the orange peel chin can be prevented or at least minimized with the treatment of neuromodulators.
Right. So all these, prevention is key, honestly, because don't wait until you have deep lines and wrinkles, because then we can't, it's harder to treat, and you're having to do other things. You do the neuromods, which is what we call Botox. You do that, you have to do laser, sometimes fillers. So it's better to prevent. All these 20 and 30-year-olds have it right. They're never going to have lines and wrinkles. It's perfect. So prevent, don't wait to treat.
Prevent.